All right. Good morning, everyone. It is Clinical Trials Day. I am stoked. Thanks for everyone who's tuning in. If there's anyone tuning in, I know that was pretty impromptu, but it's Clinical Trials Day. So come on. Mitch, how you doing, man?
Good morning. Doing well. How are
It's
you?
Clinical Trials Day.
No,
It's,
happy
you
Clinical
know,
Trials Day.
I get ready for Clinical Trials Day in December, man. It's stoked. I mean, this is like, we need to have like some kind of a, hey, can we get like a DiversiTree? Like put a DiversiTrials tree up there and put on their ornaments for all of the people that we're helping, all the lives that we're saving, show some kind of a symbolism.
Yeah, I love it. I obviously wanted to do costumes too. It shouldn't be limited to Halloween.
So special shout out to my daughter. She went to a baseball game this weekend and she said I could wear the jersey. So go Cards. I told her I would say go Cards. Any Cardinals fans out there? Anyone from the Midwest? All of my.
I used to be a Mark McGwire fan. That counts.
There you go. Yeah, Mark McGwire and Sammy Sosa, the two Midwestern teams that did the home run derby. Hottie, how are you?
Good morning, everyone. Mondays are usually not my best days, but because it's a happy National Clinical Trial Day, so it is one of those days. I'm stoked as well, and thank you for being here.
I am stoked too. Clinical research is literally my life. That's what I wake up to do every single day to make sure that we can save lives. And big shout out. So if you Google Clinical Trials Day, because I was trying to figure out the colors, like the Clinical Trials Day colors for the to wear, and it was actually founded 10 years ago by ACRP. They're the ones that established National Clinical Trials Day. So not only is it Clinical Trials Day, but it is literally the 10-year anniversary of ACRP establishing this as a holiday.
Nice.
So, yeah, big. Today's a really, really big day. So if you have a site, buy them cupcakes. If you're doing anything, make sure that you celebrate. We want to make sure that we recognize not only, like, that's the cool thing about Clinical Trials Day is so many different people can celebrate. The patients can celebrate. The pharmaceutical companies can celebrate. The sites, the front lines can celebrate. Everyone can celebrate Clinical Trials Day. So I got to ask you too, because you're in the industry. What do clinical trials mean to you?
I was gonna use one of your words, Mitchell, unconditional. But you go ahead. I don't want to steal your thunder. Go ahead.
No, take it. That's a good word, obviously. Unconditional. I love that. And I think to me, I really wanted to jump on today to kind of highlight one of our partners, Diverse Research Now. Everything that they're doing is focused on truly just supporting patients and helping patients get into trials and educating the communities, all throughout the U.S. And being there and having that support to help those people is what you hear from most, CRCs. That's tends to be their favorite part of the job. It's not like, oh, I love collecting and shipping lab samples. It's those relationships that you get to build with the patients and care partners of patients, and really just kind of holding everybody's hand and helping them along their journeys, unconditionally, because you don't interact with any one individual patient for a specific purpose other than you truly just want to help patients and help these people. But all of that amounts to, the beauty of it is all of that amounts to this really greater concept of, creating better drugs and creating better, clinical practices and developing, future research studies. And every little bit that we're doing along the way just adds more education so we can have, better tomorrows.
Yeah, wonderful. For me, Dr. Fox, today is this. We're trying to add some, attributes and values to the Happy National Clinical Trials Day, but this should be the standard for every single day, 24/7, 365 days a year. Besides being unconditional and giving unconditional, I would say pay it forward. Just do the best you can without having to really think about what is the ROI, what am I getting out of this. Just pay it forward, do the best you can. If you like to gossip or bash people, just stop it. Don't show insecurities. Um, it's all about giving and receiving love. It's not about showing insecurities. It's not about the gossiping. It's not about trying to show off. Just do some things, and you don't have to always talk about what you're doing. This is what we do. I mean, we do a lot of things, and we don't have to show off, and rub it in front of everybody's faces that we're doing this and we're doing that, we're doing this and we're doing that. This is not how it goes. Right, pay it forward, do the best you can, pay it forward, and expect the best from the universe, without being insecure, without being wanting to show off. And those standards, those values should be an everyday value for everyone in the industry. We need to give unconditionally. We need to love and provide unconditionally. We have to be very secure, with ourselves and with our, the things that we do on a daily basis, and just pay it forward. Pay it forward, pay it forward. Don't expect, people to come and tell you thank you if they do wonderful. If they don't, deep down inside they do. That they appreciate you. You don't have to have this recognition always in your face. Like, don't ask for recognition. Don't look for recognition. Don't be an attention, seeker. Do it from your own heart. Be proactive. Pay it forward. Stop your insecurities.
And if you think about it, unconditional wraps around the patient experience as well, right? Patients, by standard, by law, they participate in trials unconditionally. There are no conditions, no strings attached. You can withdraw consent at any time. You're doing this completely as a volunteer. Unconditional is actually a very, very strong word in clinical research on patients. For unconditional participation. For professionals, there's unconditional love. You're trying to do this unconditionally. You're not being racist. You're not being biased. We're bringing everyone together so that everyone has access to it. It's a very good and powerful word. So well done, Mitch. Where's your hashtag? We got to get a hashtag for that.
I know. Hashtag and merch. I'm going to make t-shirts.
Unconditional. Yeah, unconditional research.
I love it. I love that. Yeah.
So
trivia time.
Okay.
Do you guys know why Clinical Trials Day is May 20th?
I just saw the blurb on LinkedIn from one of our, I think Stacy Lamb, she was posting it. It was celebrating the very first documented clinical trial.
Yep.
Right.
James Lind. It's a scurvy trial. So I'm also thankful that I don't have scurvy.
Yes. Thank goodness for scurvy. Everyone get your ascorbic acid. Make sure that you're set. So something kind of hit my mind, and you go through these, you have a few of them throughout your lifetime. And I guess the older you get, the more of them you get. But do you ever face those moments where you get plugged out of your own little world and you realize you're part of a bigger world, and like everyone is watching something at the same time? They know that they're establishing a memory of that. So I know everyone talks about the Challenger. I must have been too young for the Challenger, but everyone watched the Challenger explode when it did that. And then for me, my very first one of those moments was actually Operation Desert Storm in the 90s, because I had family living in Kuwait and we knew the Desert Storm was happening, and we thought, oh my gosh, we're all watching this. Of course, everyone remembers exactly where you were during 9/11 if you live in the United States. You were watching the TV, you saw buildings collapse, and you thought to yourself, oh my gosh, my world is changing around me. What do I do? Oh my gosh, my world is so much bigger than my little life around me. And then, of course, there's COVID. I'm sure everyone out there remembers what they were doing, what they were like being when COVID hit, when the entire world froze. And as clinical research professionals, where you were, and you had everyone looking to you saying, oh my gosh, what are we going to do? Oh my gosh, I'm scared. Oh my gosh, we've got the death tolls in the millions and billions. So while we celebrate National Clinical Trials Day, I think it's really important to focus on the importance of what clinical trials does to our world. It literally saves the world. So my question to both of you is, where were you when you realized that COVID hit this world and it was never going to be the same?
Working.
starting
to transition from women's health trials to COVID studies. pretty quickly.
And you saw the news and you're like, oh my gosh, research has to pick this up and we
Yeah,
have
I mean,
to step it up.
admittedly, I think like many people, it's when news first breaks and it's starting to go global, and you're like, well, we'll see how bad it actually is. And then reality starts to set in, and you're like, oh, okay, this is kind of a big deal. And then you have to quickly be able to pivot, and you've got to be able to adapt, make those adaptations so you can modify your life. And the industry completely changed, overnight, it seemed like.
What about you, Hadi?
Well, I was traveling internationally. I was in Europe and, bound to get back to Houston, to the US. And I was like, oh, okay. I mean, so my sister would call me and would say, like, I mean, something is going on. Watch out for the flights. Watch. I was like, what's going on? I don't get it. I was like, not a big deal, not a big deal, not a big deal. It turned out to be a very big deal. I got stranded for 8 days, going from one airport to another, sleeping on the floor at airports, just wanting to get on a flight to get back home. My kids were waiting for me, and it's like, oh my god, this is global. Everybody's talking about it. Everybody's concerned. It's on the news at the airport. Everybody's listening. It's like an airport shut down. Some terminals were shut down. It was a big deal. It was like a mass big deal. And it was a mess at the same time. So yeah, I mean, this is where I was, and this is what I was like, oh my god, this is gonna hit big time, and the world is changing. And everybody was talking about how tomorrow is gonna be different, how everybody's gonna be affected, the whole 9 yards. So this is how I received the news, and it stayed with me. It's like, this is a big deal.
Yeah,
Yep.
and as an epidemiologist and public health expert, a lot of that, a lot of the steps following were probably really well written on the wall for you already.
At the beginning, it was very overwhelming, Mitch. Reports from everywhere and watching the news from everywhere. Everybody's saying something. There was no concrete science at the beginning, so that was a little confusing and stressful. But as we, maneuvered and the tread that water, slowly but surely, we started, receiving the big picture. So yeah, it was a big deal, and then we still we still don't have all the answers till today. But it was something that we learned along the way, and we dissected it slowly but surely along the way. Again, still many questions unanswered, and I truly believe that there should be post surveillance marketing, big time.
Oh yeah, yeah. And I remember the very last day that I was at the site before lockdown. I remember having to go to the grocery store. Wanted to pick up a couple of things. Shelves were bare. People were panic buying. People were freaking out. You remember the toilet paper shortages and all the shortages that we talked about, and and then all of a sudden it was, oh my gosh, all eyes on research. Literally all eyes. Research became politicized, which was interesting because this one kind of like the side hobby for some doctors, and it's this, oh yeah, it's over here and it's for really really sick people. It turned into, oh my gosh, this is literally what we need to save the world. And then I remember having patients on trials, long-term trials. We had patients. We had to figure out how to continue those trials and those visits during COVID. If a coordinator was sick with COVID, we have to figure out how to do things correctly. We just had to keep going even through a pandemic while at the same time saving the world.
Yeah. So
Right.
to my shout out to Diverse Research Now again, in what they do as far as educating communities, and part of educating is also combating misinformation in healthcare and in research. Research has always had a negative stigma to many, and justifiably, there's a lot of broken trust, and that stigma holds for many as well. But during COVID, we also saw, to your point, Dr. Fox, like a remarkable amount of individuals who, within a week, were suddenly clinical research professionals and experts. You did have a lot that didn't know and weren't familiar, but you get people who read like one or two articles, and depending on where your source is, it's like, oh, this was too fast and this doesn't make sense. And the normal clinical trial takes this long to run. And it was quite interesting. So a lot of constant, I mean, you said everybody like looks to you, especially as a CRA at the time working on some of those vaccine studies. It's providing that information and reassurance, and trying to be able to explain the science in layman's terms, and really help demonstrate that, hey, we're doing everything we can. This is safe. There's multitude of people who've been tested at this point. It's not like we just threw something together in the garage and we're like, here you go.
And to your point, Mitch, trying to explain that to kids, that was very challenging, and but it was a good exercise, actually. I mean, from my own perspective. So yeah.
So I think that we as clinical research professionals need to take COVID as a number of lessons that we can strive for. Number one is that it is possible for us all to come together to achieve something. We're always at each other's throats for something, whether it's money or politics or finger pointing, whatever it might be. But when the world stops and people are depending on you to keep it going, everyone came together to get this world back together through clinical research. And I'm talking the big sponsors and CROs, they just said, we're releasing all of your withholding. Take the money. We need you to be functional. We had, patients lining up in the community saying, sign me up. I'm willing to do this for my children and for my generations to come. I mean, research is possible and it can happen with everyone. And if you really look at it, it can happen really quickly, right? I mean, when the first COVID vaccine, I don't know if it was successful or not, but at least for the first clinical trial, it was injected in March of 2020, about a month, 6 weeks after it hit, after everything closed down. 6 weeks, guys, 6 weeks, and we had a clinical trial running. Now, granted, they had 2009 data from SARS-CoV, so it's not like they started from scratch, but the regulations, everything hit, it was possible.
Right.
So I don't know. And the other lesson that really struck me with the COVID dynamic is the value and the importance of research in our community. Like, research literally saved the world. And we have seen that happen so many times throughout history, where we really cannot forget how important it is to have good quality research happening at all times in this world. We can't just shelve it for the next big pandemic and hope that it's going to get better. We've got to do better.
And along the same lines, even though I'm switching gears a little bit right now, but along the same lines, and to your point, Dr. Fox, is that yes, we need to actually do the best we can and move forward and include more people in terms of underserved minorities, like whether in this country or outside this country, in Africa and the Middle East. I mean, that will come all together to really have a bigger, better quality of research for the global good. So it's like it's all intertwined in some ways. We just have to keep this growth mindset and always talk about how we can do better.
Yep. So I didn't want to do a super duper long podcast,
Right.
just enough to pop on and say happy clinical trials to everyone. Wanted to tell our stories. If it's okay with you guys, we'll go ahead and wrap it up. I'll have one more follow-up question for you. And this is kind of what you were alluding to, Hadi, is where do you want to see research go in the next 3 to 5 years? What do you want to see happen?
Definitely to be more inclusive, more equitable, and again, to expand to new places on Earth. The US is kind of saturated, and I'd love to see more expansions to Africa, to Middle East, and other parts of the world as well, Latin America. So, I mean, it's a must. It's a must. We have to have more representation so that we can know exactly the whole spectrum of what goes on in each separate. I mean, to go through different genetic profiles basically, and see how drugs are being metabolized and being or affecting different genetic profiles, so that we can get personalized medicine. That's the big thing right now, and we have to really be proactive and push forward and try to expand and include more population, which have not been adequately, let me put it this way, adequately and accurately studied in the past. So we're making history. We're changing history. Now, MENA is a new separate category in the US, upcoming US 2030 census. We're making history slowly but surely, but we have to be consistent, insistent, and proactive in terms of being very vocal, in terms of showing how important this is to move forward with this agenda.
Yeah. So definitely like almost the globalization of clinical trials. I mean, everyone is literally like one airplane ride away from somewhere else on the earth. We are already turning into a globalized society. I mean, we've still got borders, we still have countries to help to silo our populations, but we are all still humans on this earth. And I think that everyone coming together for clinical trials to be like, what was it? You said three things: persistent, insistent, and consistent.
Being consistent and insistent and proactive in terms of not just, be very vocal in terms of what you want. Be secured enough to say that this is what's needed. Be proactive. And then you brought up the human being issue. Again, for me, everybody is a human being. Do not treat anybody as a patient, as a subject, as a participant, or as a number. For me, you have to reach out with sensitive, personal community outreach programs, depending on where you are, bespoke programs, and deal with everyone on a human, as a human being on a personal basis. For me personally, yes, probably digital marketing and all has its own place at times, but it's not successful across all boards. So we just have to be cognizant about what's going on globally and how we can actually deal with human beings from different backgrounds differently.
What about you, Mitch? Where would you like to see clinical trials in the next 3 to 5 years?
I will second what Hadi says. I feel like the more and more work that we're doing every day, the more I see new partnerships that we're making. A lot of really shared interest and passionate people that want to continue to push and fight for better standardization and practices for diversity and inclusion. That said, it's essentially kind of like this way we're almost capturing the data. But when you talk about like globalization of clinical research, we're all a bunch of nerds, and we should appreciate the value and the data that you can get from that, because when you're from that like public health mindset, right? This perspective of looking at, yes, we're doing a clinical study and you're focused on the drug, but it's greater than that. A lot of times, especially when you look at like indications of what you can and can't eat with certain meds, it's like, okay, well, you can't have grapefruit. Well, you figure that out somehow, right? So the more globalization, the more you can look at, potentially, or at least have that opportunity to look at, other regional environmental factors and, dietary habits, and, kind of take a different approach potentially, because the research has been conducted on these global levels and these global scales. It opens the door to be able to do additional investigations and additional research and gain more knowledge. It just makes all the studies that we're doing more valuable, the more specific and granular the data we have.
Yes, and under the social determinants of health, as well. So that would be a big deal.
So I think my wife told me this one, but there's a quote where you say, if you stay ready, you don't have to get ready. And that's kind of what I'm hoping is going to happen, is everyone like literally just pulled research off the shelf, used it, and wore it out pretty hard, and then put it back up on the shelf. And you're seeing people trying to bury research in priority again. It's, we don't need it anymore. We need to focus on these other things. But I really do think that if we want to prevent the next emergency, we have to make research part of our society in a way that it's not forgotten. And that's why I'm so glad we have National Clinical Trials Day. But for me, next 3 to 5 years, it's probably going to be the rest of my career. It's literally just a matter of going out into the communities and making sure that people know about research, because most people don't. Like, I went to the coffee shops, right? I guarantee you, almost every single coffee shop you go to, anyone you strike up a conversation with, unless you're in a really, really research-rich population, it's going to be, well, I didn't know we even had that in this community. Oh, I didn't know about that. It's like this hidden gem in every single community. I mean, across the country, across the world, there are little bitty pockets of people doing research, but it's not enough to make an impact for what we need.
It takes more than one time to really explain what's going on. Like even with my friends and colleagues in my community, I keep on explaining, what is it that I'm doing? What is it that I'm interested in? Where should we be heading? And I keep on, probably attacking it from different angles. But they're inquisitive. But you need to really be persistent in terms of how you present it and with your passion, so that they can really get it and be part of it.
Mm-hmm. And passion is the thing. That's the one thing about everyone in this industry. They are very passionate, and they're passionate for different reasons. But boy, we are in quite the community of very active, passionate, and frankly fun people to work with. So I am so thankful that I have the opportunity to have fun, professional fun, with my friends. And I really do appreciate both of you coming on today and talking about Clinical Trials Day, because it's one of my favorite days of the year.
Awesome. And thank you for this opportunity. Thank you.
All right. So as promised, we're going to be done before 30 minutes. So this is Dr. Fox. Like, comment, subscribe, CRPN Central. Please like, comment, subscribe, and support DiversiTrials. Get ready. Mitch, do you want to give any spoilers on things that are coming in DiversiTrials?
No, I mean, if you're in the industry and you're going to be at SCRS West in Scottsdale, Arizona, June 3rd, we're going to have an event that evening. So reach out or just check our DiversiTrials LinkedIn page and you'll find posts about it and RSVP, and we would love to see you there and talk more.
Sounds pretty spicy.
I like that. That's a good spoiler. It's an Easter egg. I love it.
Yeah. All right. Like, comment, subscribe. Thanks so much, everyone. Happy Clinical Trials Day. And go out there and hug a clinical research professional. Seriously, exactly. They'd appreciate it.
Exactly.
All right.
Starting with hugging you first.
Hugs.
Hugs. Bye.
Bye, everyone.
Bye.